Well, new this morning and only on 2, chronic pain sufferers want lawmakers, doctors, and their neighbors to feel their situation.
Many patients say changes in laws and fear make them feel like collateral damage in the opioid crisis. 2 Works View's Karen Larson begins our day-long look at the challenges they face.
For more than 2 decades, high doses of opiates helped ease Lori Bonebrake's chronic pain.
I have MS, fibromyalgia.
But now she has trouble getting the medication she needs. The Bartlesville resident blames confusion over state and federal prescribing guidelines. She says many primary care doctors no longer write prescriptions for opiates to treat chronic pain. Dr. William Yarborough specializes in pain management.
A lot of patients who had been seeing their doctor for arthritis and various other painful conditions had been getting opiates for pain chronically, and then suddenly they're not getting them anymore.
Or the size of the dose is much less. Patients call it forced tapering.
Well, I was forced down from 420 morphine equivalents down to 90 in less than a month. In the first 3 weeks, I was in horrible withdrawals. Worst pain I've ever felt in my life.
CDC prescribing guidelines say opiates should not be a first-line therapy for chronic pain and should be considered only if expected benefits for both pain and function are anticipated to outweigh the risks to the patient.
The CDC, they were guidelines, not requirements. And the doctors are all taking it as law.
Dr. Kevin Taubman is the past president of the Oklahoma State Medical Association.
Those are guidelines, they're not absolutes.
State and CDC guidelines do allow opioids for chronic pain patients who don't show signs of addiction.
Some of them do need opioid medications.
And the guidelines do allow for prescribing higher doses with careful monitoring.
It took like 10 years to find the right combination of medication that worked well.
Bonebrake says she's one of the many Oklahomans who consider themselves collateral damage in the opioid crisis. Patients who for years or even decades controlled chronic pain with opiates without abusing the drugs or becoming addicted.
And I think some of those individuals probably did get marginalized.
However,
I think the term collateral damage is a little more of an overstatement. I think the fact is that all these individuals at various degrees have justifiable conditions that need pain therapy of different types, which can include opioids.
Dr. Yarborough says when primary care physicians don't understand guidelines, they sometimes simply stop prescribing opiates altogether.
It's too risky for them in their minds.
Coming up tonight at 6, how that impacts chronic pain patients, especially those who don't live in a community with a pain management clinic. Karen Larson, 2 Works for You.